Hello and welcome to today's tutorials on ECG basics. As we know, the ECG is an important diagnostic tool in medicine, and as such, all clinicians must familiarize themselves with it. Today we are going to look at the normal ECG so that we will be able to distinguish it from any abnormal ECG when we find one. And so in an outline, we are going to look at the waves, the intervals, and segments, as well as a little bit on the ECG paper. Now, when you pick the ECG, the first thing you must try to identify is the isoelectric line. And this is a baseline tracing without any electrical activity. And so it represents the resting phase of the myocardium. As you can see on the right, the red line, the thick red line over here, is depicting the isoelectric line. Now, we have waves which deflect above the line, and we have waves which deflect below the line. And so waveforms and intervals are measured at the point of deviation from the isoelectric line. Anytime a wave deflects above the isoelectric line, we say it is positive. For example, the P and the R wave. And when the deflection goes beyond or below the isoelectric line, we say it is negative deflection, as the Q wave and also the S wave. Now, after this, what must we look for? The first deflection of the ECG is the P wave. The P wave is a small upward wave that appears first. It indicates atrial depolarization, or the contraction of the atrium. And during this time, there is spread of excitation or impulses from the SA node to the entire atrium. Now, about 0.1 second after the P wave has begun, the atrium contracts, and this is why we say the P wave represents atrial systole. If you look at the diagram on the right, this is how the P wave looks like. The amplitude is 0.05 to 0.25 millivolt, or about 2.5 small boxes. And the duration, that's what time, it's between 0.06 to 0.012 seconds, which is about 1.5 to 2.75 small boxes. Now, as you can see over here, I'm going to show you all the P waves in this ECG. So this is the P wave. Anytime you pick the ECG, this is the P wave. And as you remember, we learned in the ECG paper that we have standard lead 1, lead 2, and standard lead 3. So these are the P waves that we must look for. The P waves precedes all QRS complexes. Now, they are called upright or positive P waves when they deflect above the isoelectric line. Sometimes, however, they may deflect below the isoelectric line, and so they become negative P waves or inverted P waves. And so it is important for us to know that P waves are inverted in standard lead AVR, as you can see in this diagram. So this is AVR, and you see the P wave is inverted, and also over here you see that the P wave is inverted over here. QR complexes can also be inverted, and this is usually relative to the isoelectric line, or have an upright configuration relative to the isoelectric line, as you can see over here. So after the P wave, what else do we look for? We have the QRS complex. It is the second wave that begins as a little downward wave but continues to become a large upright triangular wave and also ends as a downward wave. Now, I'll show you a diagram very soon. But just after the QRS complex has begun, the ventricles begin to contract. And this is why we say the QRS complex represents ventricular systole. Now, the the duration with which the QRS complex takes is about 0.12 seconds, and the amplitude is about 0.5 millivolts. And as the name implies, it's a complex, and so it is made up of different waves. So we have the Q wave, which is the first negative deflection which precedes the R wave. If you look at the diagram over here, this is the Q wave, the first red deflection over here. This is the Q wave, and it is the first negative deflection. It comes before the R wave. This is the R wave, as I'm showing over here, and the R wave is the first positive deflection of the QRS complex, irrespective of the presence of the Q wave. So sometimes it may not be even a Q wave, but the moment you see a positive deflection above the isoelectric line, it represents the R wave. And after the R wave, we have the S wave, which is also any negative deflection after the R wave. So this is going to be our S wave over here. And the duration, as I said, is between 0.06 to 0.12 seconds. So basically, we may have about 1.5 to about 3 small boxes. Now, after the QRS complex, what else do we see? It's important for us to know that we have various forms of the QRS complex. So for example, we have the Q to be a negative deflection and the R a positive deflection. Then the next negative deflection following the R wave being our S wave over here. Then we're also going to have our R S deflections over here. Then we also have the Q and the S deflections over here. Then we have as you can see, various forms of the QRS complexes, showing, over here. You can take a time and look at it very well. Now, after the QRS complex, the next wave we get is the T wave, and this is the third small wave, and it's in the form of a dome, shape. It's upward or it's positive deflection, and it indicates, ventricular repolarization, or the diastole of, or the resting phase of the ventricles. And one important thing we must know is that the atrial diastole merges with the QRS wave, and so we do not have a representation of the atrial, relaxation on the ECG. Now, this is the diagram of the T wave. As you can see, the amplitude is not more than 5 millimeters. As you can see, is amplified over here. It is asymmetric, it is smooth, it is rounded in morphology. Now, an interesting thing that we must know is that the T waves are always upright in almost all the leads, with exception of AVR, AVL, and sometimes precordial lead 1. And so if you look over here, this is going to be our T wave. It is positive over here. This is our T wave. It is positive over here. And as I've indicated, less than 5 millimeters, or 0.5 millivolts. This is because, as you can see over here, one big box over here represents 5 millimeters, or 0.5 millivolts. So this is a normal T wave, as you can see over here. This is also another T wave. But as I've indicated, the T wave is negative in augmented lead AV, R, as well as AVL. Another important thing that we must know is that the T wave is highest in precordial lead V2 and V3. And so if you find this in any ECG, it is normal. It is a normal amplitude of the T wave. This is not anything to cause alarm. Yeah. So that is it with the T wave. Then the segment. Now, when we say segment and intervals, what do we mean by segment? A segment is the region between two waves. I will show you a picture very soon. And an interval is the duration of time that includes, one segment and either one or more waves. This is what I mean. This from the end of this wave over here, the P wave over here, to the beginning of the QRS complex over here forms a segment. So between two waves, so this is the P wave and this is the QRS complex, another wave, or the Q wave. So the distance between them is what we refer to as a segment. So you can find another one also over here between the S and the T, also forms another segment. So how many intervals and segments do we have? Let's quickly go through them. So we have the PR interval. When we say the PR interval, is the segment which starts at the end of the P wave and ends at the beginning of the QRS complex. So in this diagram, as you can see, we start measuring from this place as the arrow is pointing. So from here, we measure it from here to the beginning of the Q wave. So the time interval from this place to this place, what we refer to as the PR interval, and usually is about 0.1 6 seconds in duration. Now, the next one that we need to look at is the QT interval. When we talk about the QT interval, the QT interval starts at the beginning of the QRS complex and ends, or terminates at the end of the T wave, and usually denotes the electrical systole of the heart. That's the contraction of the heart. So in the normal duration is also 0.36 to 0.44 seconds, and it usually is between 9 to 11 small boxes, as you can see over here. So from here to here will be our QT interval. Now we also move on to see our ST segment, and the ST segment starts from the the end of the QRS complex. So we measure it from the beginning of the end of S to the beginning of T. So the ST segment starts at the end of the QRS complex and ends at the start of the T wave, and it usually represents the time when the ventricular fibers are fully depolarized. So that is it. So it represents the time when the ventricular fibers are all depolarized and they all contract. So that is it. So another important thing I must mention over here is the J point. The J point is where the ST segment starts. So in this diagram, you are going to find the beginning of or the end of the S wave and the beginning of the T wave. So this is going to be our ST segment. Interestingly, we may have pathologies whereby the ST segment may be elevated, as you can see over here. So this being our isoelectric line, we are going to have the J point being above over here. So the ST segment is elevated here, and we are going to have in some instances whereby there is going to be a negative deflection over here, and so as you can see, there is a depressed ST segment with the J point over here. Now when we talk about segments and interval, an important thing we must know is that in intervals we describe the duration of time. And so the problems cannot be, with the morphology or depression of, the waves or elevation, of the waves, or even intervals, as we see in segment. And so intervals only talk about the duration, and so intervals may be prolonged or intervals may be shortened. When we talk about segments, segments, the problems associated with segments are usually, in relation to its morphology or the structure, and so we are going to have, things like, elevation, as in, in STEMI, ST, elevation, myocardial infarction, or even depression, as in ischemic, heart, diseases. So that is it. It's very, very important for you to note that segments talks about morphological problems, and intervals talks about problems with duration. Very, very important. Now, this is everything brought together. So from this point to that point is what we call the RR interval, and this is how we measure the heart rate of the patient. We try to count the number of big boxes in between each R and R, and we are able to determine the heart rate from this. So this being our PR interval from the beginning of the P wave to the end, or the beginning of the Q wave forms the PR interval, and the segment is going to be from the end of the P wave to the beginning of the Q wave, being the PR segment. And our QT interval is going to be the beginning of the QRS complex to the end of the T wave, and our ST segment is going to be from the end of the S wave to the beginning of the T wave. So in summary, what have we learned so far? We've seen that on the ECG, the first positive deflection is the P wave, which represents atrial depolarization or contraction of the atrium. From the P wave, we are going to have our QRS complex, and the QRS complex represents ventricular depolarization or contraction. And after the QRS complex, we are going to have, the T wave, and the T wave is going to represent the ventricular repolarization. And as I said earlier on, the relaxation of the atrium and the contraction of the ventricles takes place at the same time, and so we don't have any representation of atrial relaxation or diastole on the ECG. Now here we find our Q wave, which is the first downward wave of the QRS complex. And we also have our R wave, which is the initial positive deflection, and also the S wave, which is the negative deflection following the R wave. So this is all that I have for you in this tutorial. Thank you very much for your time.